Not everyone in Italy wants to receive the AstraZeneca COVID-19 vaccine. It's following safety concerns after one person in Austria died from coagulation disorders. But the World Health Organization and the European Medicines Agency says it's confident about the safety of the inoculation and urges people to take it. Meanwhile, Italy is tightening its restrictions, turning the nation into a complete red zone over the Easter weekend as confirmed cases rise again. They are necessary to avoid a worsening that would make even more stringent measures inevitable. These measures are accompanied by government action to support families and businesses and the acceleration of the vaccination campaign, which alone gives hope for the exit from the pandemic. In France, those over the age of 18 are being recommended to take the Johnson & Johnson shot. The health authority says it's preferable for areas where the virus is spreading quickly. Prime Minister Jean Castex has concerns for the situation in Paris, though, as 95% of the intensive care units in that region are COVID-19 patients. The government says it's ready to impose further restriction measures if need be. More than 90,000 people have died from the infection so far in France. Meanwhile, in Greece, there were more than 3,000 new confirmed infections in the last 24 hours, the highest daily record since the pandemic began. ICU units have also reached 95% capacity in Athens with COVID-19 patients. There have been dozens of anti-lockdown demonstrations in the capital and other Greek cities over the strict measures, which have sparked clashes with authorities. The centre-right Prime Minister accuses political opponents of ignoring appeals for calm. However, in Portugal, the measures will gradually ease from next week. Children will be able to go back to daycare, preschools and primary, and some businesses will be able to open. After 2 weeks, museums and small shops will be able to come back to life. And restaurants and cafes could potentially open after May the 3rd.